Atrial fibrillation is common, and the most feared complication of atrial fibrillation is stroke. So what can we do to prevent it, and what treatments are available to us from the emergency department?
About 15 to 20% of strokes that we treat and the strokes that occur on the stroke unit are due to atrial fibrillation.
I feel a little helpless because we have limited treatments for stroke. And it does always seem like a shame if the opportunity had never arisen to start a preventative blood thinning to prevent the stroke.
Experts recommend that starting a new oral anticoagulant in the emergency department may be the solution to the stroke prevention in patients with atrial fibrillation.
Recent work has shown that if people are started on anticoagulants, they're much more likely to be on appropriate anticoagulation 6 months later, 12 months later if it's initiated in the ER. And this is a very good initial point of contact. So really it's everybody over 65 or those with cardiovascular risk factors that would potentially benefit from anticoagulant.
And so historically we've had a lot of problems with that because starting them and arranging for appropriate follow-up has been a challenge. We've worked very closely with our thrombosis service in Hamilton to ensure that we have a essentially seamless transition from the emerge.
So part of this initiative is actually education and support for the emergency physicians so they feel empowered that they're doing the right thing, and guidance on the ideal medication to start and the ideal dosage.
Your average at-risk patient with atrial fibrillation would have a stroke risk somewhere in the neighborhood of 4 or 5% per year untreated, and we can cut that down by 60 or 70%.
So not only are you preventing strokes, but just being on an anticoagulant reduces the size of a stroke even if you were to have a stroke while on anticoagulants.
As an outsider in cardiology, I would love to see more initiation of oral anticoagulation in the ER.
I think the sooner you get that person on an anticoagulant, the sooner you're reducing the risk of having a stroke.